Hi, if you're watching this, you probably already know who I am. I am Adam Van Spankeren, the Navigator Program Manager with Covering Wisconsin. I'm recording this as kind of a follow-up or supplement to the Wisconsin Enrollment Conference this year. This is going to be focused on the Navigator exam and maybe some key concepts or especially numbers that might have been missed that might be helpful for anyone taking it, trying to pass the exam either the first time or retaking it. And hopefully the concepts here will be helpful. And I'll also talk a lot about the kinds of questions, the way things might be presented, and how to think about this so people will have a good chance at passing. So hopefully this is useful. I am going to go ahead and stop video and open up the presentation. All right, so preparing for the Navigator exam. So a couple things that are different this year. We've got a new exam vendor, which is PSI, previously Prometric. Remote testing is available, obviously, because of the pandemic, so it is preferred. And they do send out a list of rules, so read those really closely. There's a lot in there about what you can wear. It's how clean your space has to be. I think they make you show them 4 walls and just a lot in there to make sure that you don't have any opportunities to cheat or anything like that. Basically trying to replicate the feeling of a testing center. Failing the exam is normal. It happens. So there's no shame in that. No reason anyone should be embarrassed. So this year it's happening a little bit more. So it's either harder exam, but odds are it's a combination of factors. So we've got the training this year was remote, presented by different people. We've got a new exam vendor, and all of that, plus the pandemic and the exam itself being remote means that there are a lot of new challenges and reasons why it might be more difficult. And just something I've heard from the field is that there are 2 versions of the exam. Actually I got that confirmed by OCI, and one does seem to be more difficult than the other. So there is a little element of luck of the draw here, but either way, you should be comfortable enough with all these concepts that no matter how hard the exam is, you'll have a good chance at passing. All right, so just a breakdown of the questions. I've seen this written a couple different ways with slightly different percentages, but the first 4 sections, I know it says 1 is on the ACA. All of those kind of roll up into the ACA, concepts, what the law did, and how these different things interact with the law, plus basic health insurance concepts that you definitely should have picked up from the pre-licensing training or any other prep that you've done up till this point. Some questions on brokers, agents, and producers. Not very many. Those usually are self-explanatory, but I do have a couple pieces of info in here that might make those a little bit clearer for everybody. State public assistance programs, so think Medicaid, Badger Care, and then a lot on Wisconsin statutes, rules, and regulations. These, I think just because of the quantity of questions, this being 35% of the exam, this might be where people are getting tripped up. I don't think that anything there is too difficult, but the way it's being presented and just the number of different things that aren't intuitive might be tripping everybody up. And I'll go into those in a little bit more detail, but I highly recommend looking back at the other conference sessions, specifically the pre-licensing, because it does cover a lot of those. So you can go back on our conference slides page on the Covering Wisconsin website and go through to the specific sessions that you're looking for and just get a refresher on a lot of those concepts if you think you need one. Again, I'm just going to go over things and try to fill in some blanks and teach people how to be thinking during the exam a little bit. So some key terms, these should all be really familiar. All those first terms, premium, deductible, etc., you should know intimately by now, and you should know them so well that you can explain them to a consumer. If you feel like you're not super confident you could do that, just read through study guides and watch those conference sessions again. Ask veteran assisters, Covering Wisconsin folks, or people at your agency to just kind of answer your questions until you feel comfortable with those and how to apply them. Just things like co-payment versus co-insurance, one being kind of a fixed payment versus a percentage. Then I threw one term on here because I thought it might show up on the exam that I never used during my training. Is intermediary, which can be shorthand for agent, broker, CAC, navigator, basically anybody between the consumer and the actual health plan. So one thing that I know doesn't get covered a lot when we're talking about ACA is SHOP, the Small Business Health Options Program. This is, so businesses with 1 to 50 employees can get coverage from this, but they're not required to under the law. They're not required to provide insurance under the law, whereas businesses with 50 or more, or more than 50 employees, I should say, are penalized if they don't. For those with 25 or fewer employees trying to get their employees covered, there is the Small Business Health Tax Credit, and it is for companies 25 or fewer, but making an average of $50,000 a year or less, so they can offer affordable coverage. And I am just kind of trying to highlight these numbers a little bit, because that's often what shows up in the questions during the exam and trips people up. An owner cannot enroll in SHOP coverage or get SHOP coverage unless they have at least one other non-family member employee enrolling in it. And then the reason it doesn't show up in practical terms in our work is that it changed in 2018, where it's no longer offered directly through healthcare.gov, but businesses can still get SHOP coverage by working directly with agents or the insurers themselves. More on the ACA, what factors determine somebody's marketplace premium? Age, where you live, geography, specifically county, but it's usually shown as geography or where you live, family size, and then whether somebody smokes or not, which can cause up to a 50% increase in premium. In terms of these, I'm thinking income and FPL too, but if you're looking for what might appear on the actual exam or how it's usually written, this is what you'll usually see. Also for the marketplace, the different metal tiers, just know these. Bronze being the first level that meets the minimum standard, which we'll talk about in a bit, has to cover at least 60% of expenses for medical care, again, after deductible, but the way these might show up in an exam question might be, comparing them or a consumer looking to select between them. And these are the ways to think about them. So if you know bronze and you know they go up by 10 from there, you go bronze is 60-40, silver 70-30, gold 80-20, platinum 90-10. Next page, also from the ACA, these are the essential health benefits that were written into the law to go into effect January 1st, 2014. So these have to be covered by any new health plans, any plans on the marketplace. I'm not going to read them all out loud, but just want people to think about these in terms of kind of common sense and how a consumer thinks about those. When you think health insurance, these should all jump to mind. At the very least, the major ones: hospitalization, emergency services, prescriptions, maternity care. This is what we think of as insurance. So if you see in a question, you may have a list of, these, and you'll see which is not an essential health benefit. So look for kind of the odd one out. What doesn't sound right in those situations? Or in reverse, if you see a bunch of weird things and it's saying which is the essential health benefit, you look for one that sounds like regular insurance or sounds like how you think of insurance. Affordable employer coverage, you have an offer of employer coverage. Again, that has to meet the minimum value standard, which means that the plan has to pay at least 60% for major services, essential health benefits, and it has to be affordable. The affordability test that you do to decide if it's affordable is 9.5% of gross monthly income, or it was in previous years. Currently, it's 9.83, so the test may say 9.83. But there's a good chance it might say 9.5, and you could have to calculate that. So always remember that that's gross monthly income. So if it's less than that, then that coverage is considered affordable, and the impact is that person can't get tax credits through the marketplace. Medical loss ratio, I included this. I don't know if it's on the exam, but just something that the ACA did that doesn't get covered a lot. Basically, previously insurers could spend a lot more of the premium money on overhead, administration, salaries, etc. The ACA changed it so they can only spend 20% on overhead, admin, salaries, and 80% has to go towards medical care. If the insurer spends less than 80% of collected premiums on healthcare for its members, it actually has to provide a rebate for consumers. So you may see that as a question. The individual mandate, tax penalty, questions on this, we don't think about this as much and didn't emphasize this as much, but it may still be on the exam. It's not gone, it hasn't been repealed, but it's currently set at $0. So the impact is people aren't getting penalized, but it's for people and households who do not have coverage that meets that minimum value standard. So for plans through 2018, it was the higher of $695 per adult or $347.50 per child under 18 or 2.5% of their gross household income, whichever was higher. Since then, it's been $0. So the question may reflect either of those time periods. There was an insurance gap premium exemption for up to 2 consecutive months. So somebody could avoid the penalty or not be penalized if they had a gap of 1 to 2 months during the year before they got new coverage. Grace periods for missed premium. So thinking about marketplace coverage. Consumers, if they're receiving tax credits, have 90 days, provided they've made that first premium payment, also called the binder payment. For people who are not getting tax credits, that's going to be 30 days. And then another thing that might show up in terms of numbers that people might not be thinking about as actively, penalties for violating HIPAA. You may have to calculate this, but it should be pretty easy. Normally it's $10,000 per infraction. So per infraction would be every individual who has a chance to see information that you didn't, properly block, or that you didn't, that you disclosed incorrectly, etc. Usually these questions are listed as, calculate the penalty, the total penalty. And it's going to be $10,000 per instance, per infraction. And the answers are usually fairly large numbers, because they'll say 25 people may have seen, and then the answer is going to be 250,000. So that's the agency, which will be fine to that. And then it can also result in license revocation for the actual assister, agent, navigator, etc., who failed to do that, or who accidentally disclosed or resulted in the privacy breach. And then lastly, on the ACA grandfathered plans, the way this shows up usually in a question is they're listed as an exception. But these are plans that have been in place since before March 23rd, 2010. There aren't many of them left, because every time they submit to do a change, they then have to be subject to the ACA requirements. So most plans have had to make changes since then, and thus have been rolled up under the ACA. So insurance applying some of those concepts. So we had those insurance terms at the beginning. I believe there are some instances where you may have to calculate a consumer's bill. There will definitely be instances of this when you're actually helping consumers. But I just want to apply some of those previous concepts we had. So say the question says a consumer has a gold plan. It has a $1,500 deductible, $4,000 out-of-pocket maximum. So thinking back to what we talked about earlier, gold plans have 80-20 coverage. For major services, the insurer is paying 80% of bills after the deductible, consumers paying 20%. So say a consumer then has an $8,000 surgery, $8,000 inpatient procedure. It's medically necessary, so it's got to be covered. They've already paid $200 towards their deductible, their $1,500 deductible. How much will they actually pay for the procedure? So thinking about this, again, $1,500 minus $200, that's what they've already paid. They have $1,300 remaining in that deductible. So that will be the first, they'll pay that for the procedure. So that'll go towards the procedure. So subtracting 8,000 minus 1,300, you've got 6,700 left. The consumer will pay 20% of that remaining amount, which would be 1,340. So adding those together, the consumer's bill, what they would be paying is 2,640. If this shows up on your exam, odds are the numbers will be a lot rounder than that, a lot easier to calculate. But just if you can do that, then you're in good shape to help consumers, and definitely in good shape to pass any kind of question like that on the exam. Okay, so some Medicaid Badger Care. Obviously, we emphasize this, comes up all the time, especially with policy changes during our pre-licensing at the conference and during our other sessions. A lot of what we do involves Medicaid Badger Care eligibility. So I'm not going to go over too deeply into that, but just some things to think about as they might show up on that exam. So financial eligibility is 100% of the federal poverty level for adults, 300% for pregnant women and children. Just a reminder, Wisconsin did not expand Medicaid. If it had, the coverage would be up to 138% FPL, or 133 is what it's actually written as, but there's a 5% disregard. So either that might appear in any way. I think odds are most likely you'll see kind of a percentage for show up for pregnant women, making sure that's 300 for pregnant women and children. You probably won't see anything on the gap not expanding Medicaid, but as that's an ACA concept, you might. Every consumer has a right to request a fair hearing. We'll be talking a little bit more about that in terms of grievances, but if they don't agree with a decision on their eligibility, they can always request a fair hearing, which may overturn the decision. Elderly, blind, disabled, EBD Medicaid is a combination of programs, like the Medical Assistance Purchase Program, the different waiver programs, Kate Beckett. There's a lot that's rolled up into the term Medicaid, and especially elderly, blind, disabled Medicaid. So just kind of going through those, thinking, okay, I've got Badger Care over here, and then if somebody qualifies for Medicaid, it might be any of these programs over here. So you may see a question like that on the exam, but probably not super detailed on eligibility of a specific EBD Medicaid program. Newborns and mothers are eligible for Badger Care up to 60 days after birth. Then if the household income is below 100% at that time, they're still both eligible, so the mother can stay on coverage. If it's above that, but still below 300% FPL, the child will stay enrolled and the mother will have to get different coverage, such as with a special enrollment period, to the marketplace. So thinking about this other section on the exam that I think people might be struggling with, kind of the life and disability, the accident and health, insurance and insurance more broadly. So this can account to between 30 and 35% of the exam, but a lot of it is kind of self-explanatory, and I'll explain that. There's ways to think about it that will get you to your answer. A lot of it is also on the powers of the Office of the Commissioner of Insurance. So knowing what they do, they have broad powers to protect the public, basically regulating insurance, insurers, and licensing different kinds of assisters, like licensing agents, licensing navigators, and really enforcing. So you may see the language on the exam. Enforcing, you can pretty much take that back to OCI. So if you see a question on their powers, enforce is a pretty good shorthand for that. They can issue orders to enforce statutes and rules. That's kind of their purpose in a nutshell. They also have full administrative power investigation, administer, interpret, force. That's kind of, again, shorthand for OCI. So if you see those words, that is all kind of in their purview. And then regulating and revoking, if necessary, licenses for navigators and agents. So there may be questions on disability insurance policies, so not necessarily full health insurance products from the marketplace. And there are some key concepts that might show up in those questions. One of those is the right to return. So the policy holder who gets one of these plans, these policies, has a right to return, which is essentially canceling the policy within 10 days. So that's, again, another one of those numbers that might show up that you should just file away. Okay, thinking disability insurance, right to return, 10 days. We could go into more detail about what all that means, but this is really about passing the exam. So linking those ideas together in your head. Same thing for this next one. Policy is incontestable once it's in place for 2 years. Obviously, again, we could go into detail on what all that means, but I just want you to take away and file away some of these numbers for passing the exam. Fraud or misrepresentation is always grounds to terminate a policy, which is kind of what I was getting at when I was talking about you can kind of common sense your way to the answers. fraud and misrepresentation show up a lot. And they basically are what they say they are. They're, you'll see, this person committed fraud, or this agency is doing this kind of ad and they're misrepresenting their plan. So usually you can associate those with whatever is negative going on in the question and probably get to your answer. Just so that's broadly thinking about those. And we'll talk a little bit more about misrepresentation. Disability products, again, coverage. So coverage for those, 40 home healthcare visits in a 12-month period, and at least 30 days for skilled nursing care. So those are things that might show up, again, as questions. And then consumer for these types of plans has 60 days to notify an insurer of a life-changing event. And then we talked a little about grace periods with the marketplace, but grace periods for these other types of products. If they have a weekly premium, they have at least 7 days to pay that. If they have monthly premium for the type of plan they have at least 10 days. And all of their plans, they have at least a month or 31 days to pay that premium. Key elements of an insurance contract. These are just terms you might want to file away. Again, thinking about passing the exam, seeing them on questions. Insurance contract is conditional and it is unilateral. So basically, the way to think about this is most of the burden with a insurance contract is on the insurer. They're the ones who have to pay the claims. They're promising to pay the claims. That's the one party promising to do something. So that's the unilateral part. And the health insurer offers coverage. The consumer's choice is only to either take the coverage or reject it. That's your adhesion. But the key takeaway here is if you're thinking about contracts and the contract questions, responsibility is pretty much on the insurer, paying the claims, not misrepresenting themselves, things like that. Consumers' responsibility is mostly not to commit fraud or provide false representation when applying or enrolling in these programs. So that's how I would kind of think of that in terms of exam questions. Also, generally, again, ways to think about this for the exam, consumers have a right to information. Health plans and insurers have typically 30 days to respond to requests. And then the word unfair may show up in a couple contexts, typically referring to discrimination. So you can usually think of unfair and discrimination. Those do kind of go hand in hand, so that shouldn't be much of a stretch. But you also might see it show up as a refusal to pay an insurance claim or otherwise delay payment, reduce the amount of a claim. Typically, unfair is going to be a negative thing that an insurer is doing. It can also show up in terms of marketing. So again, thinking about misrepresentation, fraud, unfair marketing practices are ones that are predatory to a consumer. So some other things that might show up. Medicare, this is not an exam to become a licensed Medicare agent, so there's probably not a lot on there, but I believe there's something. So thinking about eligibility broadly, age 65 or older, I doubt it'll go into the detail of having paid Medicare taxes for at least 10 years, but it might. It's that same concept with Social Security of 40 quarters of taxes. So 65 or older, provided they essentially shorthand worked for at least 10 years, having Social Security disability for at least 2 years. So somebody who has a disability determination after 2 years, they can get on Medicare, or if somebody has end-stage kidney disease. Again, parts don't need to be an expert, but you should kind of know these in terms of these brief explanations. They're obviously a lot more detailed than that. There's lots of loopholes and exceptions and different ways that they can actually play out, but for the purposes of your understanding, either to explain them to a consumer or answering a question, Part A, that's your inpatient hospital coverage. Part B, that's your outpatient medical coverage, so more of your basics. Between those, you've got most essential health benefits covered. C, it's basically synonymous with a Medicare Advantage plan, which you're going to get through an HMO or something like that. And then D is prescription drug coverage. So you may get a question about any or all of those, and you should at least know that much so you can kind of work your way toward the answer with that limited information. So some other things that might show up. I know when I took my exam, what is SOCIO showed up, and there were several different options, and three of them sounded pretty good. It's not something that we talk a lot about. So just that might be an acronym you need to learn, or just some keywords. But that's the Center for Consumer Information and Insurance Oversight. It's a federal group that works really closely with offices of the Commissioner of Insurance for states, and is involved in our work in a lot of ways. But again, the way the question was worded is, what is it? And basically spelling out the acronym. Advertisements. So thinking of advertisements first, any print, TV, radio, web falls under that category. And then they cannot be fraudulent or misrepresent coverage or services, and an ad must clearly identify the health plan or the insurer. So again, one of those common sense type takeaways. Ads can't be fraudulent or misrepresent things, and there may be, always think about the way the question is worded and have these kind of concepts in the back of your head so you can work your way towards the answer if it isn't immediately something you know. COBRA is coverage that, if your coverage ends. Let's see, is that the Consolidated Omnibus Reconciliation Act? I may be missing a letter there, so I apologize on that. So that one may show up as an acronym. What is COBRA? So you may want to look that up because it is specific, and it just left my brain right now. But it applies to companies with 20 or more employees. So extending coverage after you lose, whether you've lost employment or like you've been laid off, you've lost your insurance, you can basically keep that insurance by paying the whole premium, without any assistance from the employer for up to 18 months, or in some cases, 36 months, but that one's a little bit rare and has specific qualifying events. Which of the following is not questions? So these are my final thoughts on the exam itself and how to think about these things. Some of these are refreshers and reminders on things I've been hammering throughout this presentation, but you'll see which of the following is not questions. So read every question carefully is what that amounts to, because you'll see a lot of things that there's an odd one out. So always look for first, what is it asking me for? And then the one thing that stands out is often how the questions are worded. Watch for things that don't sound reasonable, and work through possible answers. So there's a big common sense component. If something doesn't sound right, your gut reaction, it doesn't sound right, it doesn't sound like insurance. If you've gone through all this other training, you're probably right. One of those concepts really won't belong. So always look at what it's really asking. Think closely about those concepts and find the one that does not fit. That's going to carry you through a bunch of questions. Privacy and confidentiality comes up quite a lot in the training, of course, and I know it comes up sometimes on the exam. And again, I'm just going to say common sense covers most questions that could be related to privacy and confidentiality. You know what privacy and confidentiality are. You know HIPAA. You know not to disclose a consumer's personal information. And if you've got that concept down in your head, you won't have any trouble answering questions on that. Similarly, in terms of discrimination, you know what discrimination is, and if you see it, either which is not a form of discrimination or which of these is, it should stand out to you. Be like, hey, that's not fair. That's discrimination. So again, we have that unfair concept from earlier. And then consumers have the right to request information. I said this, 30 days is common allowed response time. I just want to emphasize that it's not going to work for every question, because we talked about some things that aren't 30 days. But for insurance, 30 days is if you have to guess and it's giving you a number of days, 30 days is often a pretty good, pretty safe answer, at least in terms of consumer requests. There are some others, we're 90 for grace periods and things like that. But 30 days, if you really don't know the answer, is not a bad guess. And then finally, we've got some additional resources. There's the OCI study guides that I was kind of re-looking at to come up with these additional tips and tricks. So there's the actual study guide, which has a lot of this in more detail. I found it a little dense, so I developed this little video that I hope was helpful. And then they also have, if Medicaid and Badger Care are really your weak point, they have a training there at that second link on basically what's relevant to a navigator in terms of Badger Care and EBD Medicaid, et cetera. We have fact sheets on the Covering Wisconsin website. I'm calling those out, especially because of things like how to calculate a consumer's bill. There's some really great questions on that, how the premium deductible works, out-of-pocket maximum, and really how to explain those to a consumer. So definitely take a look there. And then, again, I didn't go into specifics on things because this is just to help you with concepts for the exam and how to think about questions. But all the other conference sessions, there's useful information there. So if there's anything you need to refresh yourself on, by all means, go to this link, go to conference slides at our website, and go through and just refresh yourself on some of the key concepts from those sessions, especially the pre-licensing, that will be useful for you. So hopefully this was helpful. Hopefully more people will be able to pass. I'm always interested in input on the exam, so if you have a positive or negative experience, please feel free to reach out to me. Most people watching this will have my email address, I have no doubt, or are at least 1 degree away from getting a hold of me. But again, I hope this was useful, and thank you for your time and for all the work you're doing and are going to do for the people of Wisconsin. Thanks.